Hi, this is Dr. Andy Barlow with the American Functional Neurology Institute. I can be reached at AFNIseminars.com or drandybarlow.com. Today we're going to be talking about the vestibular system and how it fires into the cerebellum and then the motor output that we have from the vestibular system. So the first thing we need to understand is that when we're dealing with this pathway, like any other neurological pathway, we're going to have sensory input, then we're going to have central processing, and then there's going to be a motor output. Okay, so on the sensory input, what we have is we have three canals. In the inner ear, we actually have 5 receptors, but in this situation, we're going to talk about the canals. They have to do with anterior, posterior, and horizontal rotation of the head. So we have the anterior canal, the horizontal canal, and the posterior canal. Inside these canals, we have hair cells, and these hair cells are the receptors. So we turn our head to the right, we fire off the right horizontal canal. And the way it does this is the receptors pick up this activity of the head movement. This head is going to move. We're firing off the horizontal canal. These hair cells become activated. We're going to fire into Scarpa's ganglion. And then from Scarpa's ganglion, we're going to fire into the vestibular system. Now, this vestibular system is located in the area acoustica, which is then located between the pons and the medulla and the brainstem. We have the superior, we have the medial, lateral, and inferior vestibular nuclei. This vestibular nuclei is going to fire to the floccular nodular lobe. Okay. The floccular nodular lobe and the cerebellum, there's going to be 3 levels. In each part of the cerebellum, we have 3 levels of the cortex. We have the molecular cell layer, we have the Purkinje cell layer, and we have the granular cell layer. This is where the central processing takes place in the cerebellum. Now what we're going to do is this processing is going to go on, and then we're going to have an output. The output is going to be through the Purkinje cells. Now, once we have this output from the floccular nodular lobe to the vestibular system, we're going to have mainly 2 types of output. We're going to have an ascending pathway. This ascending pathway fires from the superior and middle vestibular nuclei. This pathway is going to fire to our eyes. And this is going to activate the vestibular ocular reflex. So, for example, if I want to fire off my right horizontal canal, if I stick my thumb out in front and I stay fixated on my thumb and I turn my head to the right, my eyes go to the left relative to my head. So your eyes will always, in health, go in the opposite direction of your head through this vestibular ocular reflex. The next motor output that we're going to have, remember right now we're looking at motor output, we have a pathway that's going to fire down the medial vestibular nuclei, which is called the medial vestibular spinal tract. The medial vestibular spinal tract fires to the cervical spine only. Then we have the lateral vestibular spinal tract that fires down the entire spine to the lumbar region. And the reason for this is when I move my head, we have to actually set the tone, and these paraspinal muscles have to adjust to my center of gravity so I don't fall over. So again, to recap, in the inner ear we really have 5 receptors. The ones we talked about today were the anterior, horizontal, and posterior canal. When you move your head in an angular direction, this is going to fire off hair cells. These are the receptors. These receptors are going to fire into a ganglion, the Scarpa's ganglion. Then they're going to fire into the vestibular nuclei, into the cerebellum. Again, up to this point, all of this had been the sensory input. Then in the cerebellum, in the cortex, at the floccular nodular lobe, we're going to have this central processing through the molecular, Purkinje, and granular cell layer. We're going to have an output. Purkinje cell fires an axon to the deep cerebellar nuclei, in this situation the vestibular nucleus. Now we're going to have a motor output. The motor output is ascending through the vestibular ocular reflex with the eyes. The eyes are going the opposite direction of the head. And then we're going to have an output through the spinal cord to control the paraspinal muscles in the cervical spine and lumbar spine, through the medial vestibular nuclei and the lateral vestibular nuclei. Again, the medial vestibular nuclei will fire down the medial vestibular spinal tract. The lateral vestibular nuclei will fire down the lateral vestibular spinal tract. I hope this has helped you out. If you have any questions, you can contact me online, or you can call me on my cell phone at 662-231-2236. I'm Dr. Andy Barlow, and thank you so much.